Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. As part of efforts to curb the spread of COVID-19, Enugu State Government commences its third phase of decontamination of markets and other public places. And in an effort to boost the state's healthcare system, Nasarawa State Government hands over 160-bed capacity hospital to the Federal University Lafayette for takeoff of its College of Medical Sciences. And British Prime Minister Boris Johnson warns of a second wave of coronavirus in Europe, defends 14-day quarantine on travellers from Spain. We begin with some good news, and that is that Nigeria recorded the highest cases of persons who were discharged since the virus outbreak, and that is 829. That's close to 1,000. And hopefully, if we continue to take responsibility, we'll see more and more recoveries. But just like the rest of the world, the country recorded more cases last night, putting the total confirmed cases of COVID-19 at 41,180. The infections are 648. And sadly, 2 deaths. The deaths occurred in Abia and Osun states. Till date, 18,203 cases have been discharged from all the 36 states and the Federal Capital Territory. With states still experiencing a daily rise in cases, the epicenter remains Lagos, whose active cases stand at 12,340. Now, more than half of the total active case numbers, that is, talking about Lagos numbers now. It will also interest you to note that 6 states have nothing or less than 5 cases on admission. The states are Kogi with 0 active case, Zamfara, Sokoto, who have 1 case each in their isolation centers, 3 cases in Jigawa alone. Kebbi and Yobe states have only 4 cases each that are being managed undergoing treatment. Let's take you right now to the southeast, Imo State. It has recorded 8 new cases, and that's in the last 24 hours. The last time we recorded cases was on Friday, so no case on Saturday, none on Sunday, and Friday's numbers were just 3 cases. Let's bring you an update from our correspondent, Isokwe Kutei.
The figures of confirmed cases of the coronavirus disease is increasing by the day in Imo State. Some indigents are worried about these growing cases, even though the increase is not peculiar to Imo State. We went round Owerri, the Imo State capital, earlier today to speak to indigents on their thoughts on these growing cases, while some also took the opportunity to speak on the federal government's directives for exiting students in school to resume.
We are talking about maybe schools like primary schools, kindergartens. You and I know the state of this nation. I don't think things have been put in place properly so that children can go back. I think there still needs to be some level of preparation for school to resume.
Government should extend whatever they are doing to the grassroots, not stopping at the township. The central and urban areas is not enough.
The challenge is in the enforcement. The enforcement is not adequate.
Meanwhile, the Imo State government is not relenting in our efforts to combat the deadly coronavirus disease. Just yesterday, the Imo State Governor Opu Zodima met with traditional rulers across the 27 local government areas of Imo State to urge them to continue to support the state government's commitment and fight against the coronavirus disease. He also urged them to step up their sensitization in their words to contain the spread of the coronavirus. We'll continue to bring you up to speed with events and happenings around here as it concerns the COVID-19 pandemic. From Owerri, the Imo State capital, Ejitope Kutei, for COVID-19 updates.
Over in the southwest, doctors in employment of the Ekiti State government have been making certain demands for their welfare as the strike enters another week. The doctors, supported by the Nigerian Medical Association leadership in the state, lists unpaid COVID-19 and hazard allowances, unpaid rural posting allowances, delayed promotion, among other issues. However, the State Commissioner for Health has faulted the timing of the action.
It is on record that it is only doctors and health workers in the employment of Ekiti State Hospital Management Board that have never received a dime as hazard allowance for over 10 years, despite same being paid to other health workers in the employment of the same state government and other health facilities across the country. It is thus not surprising that while other states, including our neighbors, have adopted the Memorandum of Understanding the federal government had with health workers on the payment of COVID-19 hazard allowance and inducement allowance, which had since been paid by federal health workers and circularized by many states, it is still a mirage here in Ekiti State. It is also pertinent to note that a doctor working at the primary and secondary level of care in Ekiti State is currently at least 2 or 3 grade level below his colleagues and counterparts who are employed in the same day, in the same Ekiti State, but choose to work in the institution of HMB because of the failure to implement promotion as at when due.
The skipping is the major issue, and from what I understand, it came on board 2014, and they were requesting, from the way I understand it, is jumping levels, the grade levels where you are being paid. Nobody is disagreeing that paying people what they think they should be paid is wrong. The only thing we are discussing is that it's not the best time. This time that COVID-19 is going on, the states are struggling to give PPE, to pay for all the things they have to pay for. The money is not just there.
And as Nasarawa State and other states battle the coronavirus pandemic, the governor of Nasarawa, Abdullahi Sule, has decried the shortage of medical healthcare workers, a challenge which he hopes the new College of Medical Sciences will solve. At the handing over ceremony of over 160-bed capacity to the Federal University of Lafayette for full takeoff, the governor requested that 50% admissions for the study of medicine be reserved for indigents to fill the gap of inadequate health personnel in the state.
I need to reiterate that government will continue to support the university and all other institutions in the state in the training of medical personnel who will handle the issue of healthcare delivery in Nasarawa State. Distinguished ladies and gentlemen, it is obvious that there is a general shortage there is indeed a general shortage of medical personnel and human resources for the healthcare sector in the country and particularly in Nasarawa State. Hence, the establishment of the medical school by the Federal University, which will serve as a necessary encouragement to our teeming youths to take up the medical vocation. I therefore challenge our youths also in this direction. As a reciprocal gesture, I would like to appeal to the university to encourage our citizens by reserving at least 50% of their seats for medical students for the indigents of Nasarawa State, Vice Chancellor. I strongly believe that this will go a long way in meeting the personnel needs of the healthcare institutions.
And it's some positive news from Benue State as the wife of the state governor, Mrs. Eunice Otom, and her son tested negative to the coronavirus. In a statement detailing her negative status, Mrs. Otom revealed that a series of review evaluations by her medical team confirmed her and her son to have fully recovered and discharged. She and her son tested positive the 3rd of July 2020 after random samples were collected during routine testing at Government House, Makadi. She encouraged people to take preventive measures to be protected, staying safe by observing the primary protocols. For more on curbing the spread of COVID-19 in the country, Dr. Abubakar Imam from the Public Health Department, a registrar with the University of Abuja Teaching Hospital, joins us from our Abuja studios. Thank you so much for joining us on the program.
Thank you. Thank you very much.
All right, Dr. Imam, with the reports from around the world, countries opening, countries also retreating and reopening again, would you say that the world is entering a new stage of the pandemic?
Well, I wouldn't say so exactly, but I still believe that we have not really reached the peak in most countries. Therefore, with the better understanding of the disease, also with the increase in testing capacities, somehow complicated with the community transmission, then definitely much more is being clear now, but not really that we are actually entering another stage. I just feel that most countries have not really reached their peaks, Nigeria inclusive.
Exactly.
Also, I believe with the steps being taken now by most countries, Nigeria inclusive, in terms of increase in the testing capacities, increase in the risk communications, especially the work done by the Presidential Task Force on the control and prevention of COVID-19 are all, helping us get the clearer picture and also attaining better outcome in terms of the management of the COVID-19. And just as you mentioned earlier, as other countries also report, then this is still in keeping with what we really see all over the world.
So I was going to say that if we have a clear and sustained intervention, and this is, to achieving our peak before we can see the flattening of the curve. But I'd like to ask you about your assessment on the impact of the previous lockdown measures that we've had in Nigeria by the federal government.
Okay. The previous lockdown was quite impactful. I would say that if we had only prolonged it a little further, if not for the, complications that came into it, or the challenges that the Nigerian populace faced while the lockdown was in progress, I would say that at the rate at which it was going, we're actually getting a better hold of the condition. I believe that health is not limited to, disease control only. We would say, or as WHO defines health, is a total state of physical, social and mental well-being of the individual. So once we take the social component, which of course, we had challenges with the economy, people were hungry, people were not able to maintain their livelihoods, most people did not have enough food in stock to keep them at home, then definitely the lockdown couldn't have, continued. However, I believe that it had a lot of impact because as we can see from the figures, after the lockdown was relieved, there was definitely a large surge in the numbers that were being recorded. However, that is not to say that relieving the lockdown was wrong. It was also in order because if only we were able to maintain the public health recommendations in terms of preventing the spread of the disease, then definitely the relieving too would have been more appreciated. However, I feel that the previous lockdown was, had a good impact.
All right. And it appears we have another week to go. That's based on the PTF briefing yesterday. We'd like to thank you, Dr. Abubakar Imam from the Department of Public Health, the Registrar of the University of Abuja Teaching Hospital. Thank you for joining us.
Thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Over in Enugu State, the government commenced the third phase of decontamination of public places and markets across the 17 local government areas of the state as one of its continued efforts to contain the spread of COVID-19. While at the fumigation exercise at the Kenyatta market, the chief fire officer said the renewed exercise is to ensure safety of citizens. The government also allayed fears of the disinfectants posing any danger to human health.
This is the third phase of the contamination. And what we have done differently is that the state government has procured minibuses and mini trucks. As you can see, we are using a motorized fumigator in a mini truck to go around. It will make it easier and quicker for us to cover a lot of areas. And we have equally improved on the disinfectants we are using. At the starting of the disinfection, we are using sodium hypochlorite as the main active ingredients. Currently, we are using isopropane. The disinfectant we are using is alcoholic based.
We have Dr. Richard Adebayo, consultant clinical psychologist with the Federal Neuropsychiatric Hospital, Lagos. He joins us via Skype from Yaba. Welcome to the program.
Thank you.
Now, the recommendation is if you don't need to go outside, please stay indoors and, of course, comply with the safety protocols. If there isn't a full and total lockdown, isn't it rather difficult to expect people to stay away from gatherings and, thereafter, of course, contaminating themselves?
Definitely, it's very difficult for people to change their normal way of life. And what we have now, we call it the new normal. But the new normal is not very good, very comfortable for people to abide with. Human beings are meant to socialize, to move out, to interact. But when you are staying alone or you are staying indoors most of the time, running from days to weeks to months, it's pretty hard for people to take that in as a new normal. So I agree with you. It's really difficult. This is a very trying times for us all over the world.
So, Dr. Adebayo, how do we enforce compliance measures? Some states like Kano, for example, in the northwest, states in the southeast are enforcing the use of face masks, the transport. India at the time was flogging citizens for refusing to wear the masks. All these are punitive measures. Are they necessary to ensure that people take responsibility?
Before we go to the level of punitive actions, we need to do more of enlightenment. We need to enlighten our people. We need to make people to understand this a kind of a biological warfare. What I mean by that is that if you see a plane dropping bombs here and there, you don't need people to tell you to run for your dear lives. And or you see armed robbers, shooting here and there, you don't need people to tell you to run for your safety. But we are dealing with a coronavirus infection that you cannot see with the naked eye. And then we have been told that one of the ways to combat this pandemic is for us to have this social distancing, to wear a face mask and other measures meant for our own safety. We call that personal responsibility. But as long as people find it difficult to believe that there's a coronavirus, because of the kind of information spreading here and there, misinformation here and there, even from medical institutions or medical personnel disputing the fact that there is this pandemic, there is a virus. So people are not really believing the true picture that there's an infection going on, that we need to use these preventive measures to stay safe. Once people believe truly that these things are real, this problem is there, that over 860 Nigerians, have died, and over 41,000 have been affected. And all over the world, the death rate is more than 600,000. If a lot of people believe this, honestly, to abide with these measures will not be a problem. So I will converse that we should do more of enlightenment. We should go to the grassroots. Government should go to the grassroots, not just relying on the text messages from NCDC, wherever. We need to go to the grassroots and keep on enlightening our people. I don't subscribe to the use of caning people, using canes or flogging people. I don't think we need to get to that level. But we need some level of enforcement, so to say. Like coming to a public place, if you are not putting on your face mask, you can be turned back to go and use face mask. But I also said, yes, government should also try as much as possible even to provide these basic things for the citizens. If you want them to abide with this, then to a large extent, let's ensure that we also make some provisions for them rather than being punitive. Let's get to the root cause. Let's get to the grassroots. Let's inform people more. Let's keep on educating them. And then the issue of compliance will not be much of headache for us.
All right, and it's not just face masks, it's also hand washing, the use of hand sanitizers and the other measures.
And sanitizer, exactly.
Thank you so much, Dr. Richard Adebayo, consultant clinical psychologist with the Federal Neuropsychiatric Hospital, Lagos. Thank you for joining us on the program.
Thank you.
Now, UK Prime Minister Boris Johnson has warned there are signs of a second wave of coronavirus in Europe as he defended a 14-day quarantine on travellers from Spain. He also says the government had to be swift and it would continue to take further action where it is necessary. It comes after the Spanish Prime Minister called UK's decision to change the rules for Spain unjust. Pedro Sanchez said tourists in most regions in Spain would be safer from COVID-19 than in the UK. Here's more on our global update. That report in our subsequent bulletin. Well, remember the safety measures to keep the coronavirus away. Take a look at our website, channelstv.com. It has the latest updates on the pandemic. All you need to do is log on. And you can access news and sports. You can see that top story there, the Benue First Lady and son recovering from COVID-19. Today, remember, we had the highest COVID-19 recoveries in Nigeria. There's several other stories there, channelstv.com. That's the program. Thank you for watching. I'm Millicent Nwoka. Stay healthy, stay safe.